Today, I have with me Dr. Viviane Oke. She was the CEO of the Day for UNICEF in 2025. And welcome.
Thank you, Jeuche.
I'm really excited to have you come. Obviously, you're doing some really amazing work. So before we talk about CEO of the Day, perhaps tell us some of the work that you're doing.
So, thank you. I'm a digital health innovator. I created a mobile app called ELLES, which aim is to help African women have access to accurate and culturally adapted health information and services. So they could book instant telemedicine with 15 types of specialists in
Wow.
women's health.
Wow.
So not just about gynecology, but all about also sexology, psychology, therapies. There is a wide range of 15 types of specialties
Services for
that
specifically for women.
yes, specifically for women, but also because we know that women, especially mothers, are not safe about
Mm,
their health if their children are not safe. So there are also pediatricians that are on the
got it.
app so that they could feel comfortable in their body and in their minds.
Sure, sure. What made you think of this idea?
So I was on a shift as a medical student in my fifth year of medical studies, and I saw a 16 years old girl that went through an unsafe abortion brought by her own mother because she was afraid that her father knew that their daughter has been pregnant. And unfortunately, to save her life, they had to remove her womb.
Oh
And I
no.
was like, this is not what I signed for in coming in medical school.
Mm-hmm.
I didn't want just to witness like things going worse and not having something to do. So I wanted to leave medical school, and that year I even failed my fifth year of medical
Oh
studies
no.
because I
You
was
were so
thinking
traumatized,
that
yes.
medical school, knowing that cervical cancer, for instance, is killing a woman every 2 minutes and is preventable by vaccination, and that even the diagnosis is the screening is free in Benin and women of now. So at
Mm,
that point now I had to reconnect to why I wanted really to be a medical doctor, and the
mm.
answer for me was solving the health system problems and especially women's health si- issues problems, because when you address the problems of the greater part of the population, yes, you are making
A
a
big
change.
difference, yeah. It sounds like you found your purpose.
Yes, I really find my purpose, and I think for equity, because when you are in hospital and you see that some mothers are insulted by the husband because their children is sick,
Mm.
and for them the child is sick because the woman had done something
Wrong,
bad or
yes.
bad,
Mm,
and leaving the woman that way for me was like I couldn't accept or concede that. And for me, I don't see health just as hospital care, but I see health as a general care, a mental care, a physical care, and a social care. Even when addressing health issues, it's important to give access to women to more opportunities for them to be independent, because by the moment they are not independent and they've been relying on someone else to pay
mm.
their health services, you are not improving their life and their health in a wide way. So that's what I'm tackling now.
Wow. I think, well, there are two things. One is you take care of the woman, you take care of the community. So I think I really understand what you're saying, but also just I'm in awe of how brilliant you are. You certainly sound like someone who has lived like 50 years. I just want to say that, okay? This is why you're here, right? This is why you're here because I think programs like CEO of the Day, they really help to show us the best the best of women, young women in particular. So let me segue to CEO of the Day. How did that come about?
So I was there an afternoon or an evening when they wrote to me and asked me if I would be interested in being the CEO of Gide, and that I will be leading the child survivor department, because it's in that department that is led by a medical doctor.
Okay.
So managing all the survival policies, not just about health, but about also social
Mm-hmm.
protection and everything about that. So as someone that is interested in
You were
equity,
excited about
I
this?
was
Yeah.
really excited. So I was at that moment the UNICEF Youth Advocate. And for me, it's like, okay, we are working now with specific a woman leading, and it was a woman that was leading that
Mm-hmm.
department.
Mm-hmm.
So you will be working you'll be working light, not with at that moment. We like the one leading the department, and we have now full power to decide and make decisions.
How was
Uh,
that? How was that experience?
Incredible and efficient, because I was working in a public health facility about immunization, ALS immunization campaign. And in town, immunization is very difficult for people to trust.
Okay.
So we really had low rates of immunization
Okay.
compared to other cities. And apart from that, the data management is a
A
huge
huge
problem,
problem.
yes,
Yeah.
in the health sector, yeah. So having that meeting showed me so I didn't say it, but as the child survival, I will say lead, I host a meeting with all the strategic leaders of
Okay.
the different components of that sector. And then in that strategic meeting, we were talking about data and digital health into
Okay.
immunization. And I was totally in my word, because it was about digital health, it
Yes.
was
Yes.
about data and everything. So it gave me an insight on the project on which UNICEF was working
Mm,
before even it became like new by everyone.
okay.
I was like, okay,
You were already aware.
yeah, okay, you should do this or that before implementing it.
Wow.
And it was really, 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 really efficient. When the director came, she's like, wow, so I can leave you in my department, because you are leading not like a youth, but you are leading as if you had
Already
already the
been in the road.
knowledge. Yeah,
Yeah.
yeah. And for me, it was really interesting. So leaving the ground and coming where decisions are made,
Being made, yes.
and now influencing the way these policies are going to be implemented
Amazing.
just in a
You know,
single day.
no, but you see, I was speaking to someone the other day. I think I was speaking to our very first CEO of the day, and she was saying to me like at the beginning of the day she was nervous, but by the end of the day she was like, "And you need to do this, and we need to do that." And I was like, "So
That's
in
it.
24 hours, as you progress during the day, you gain more and more confidence, and you have more confidence in your decision making and your influence." Yeah.
And apart from that, I felt that I really had a support,
Mm.
community support, because as I told you, yes, I was with the youth engagement team, with the gender team, and it was wonderful. They are very wonderful person. And when it comes to MDs, we are like, oh, those people that are very like restricted, not open,
Strict, yes, yeah. Conservative, yes.
conservatives. So it's not the same thing to reach out to people working in youth engagement that to people working very on technical
Mm-hmm.
issues that
Mm-hmm.
way. And being CEO of the day has broken
All of those barriers,
Yes,
yes.
and I felt now very close to the
Oh,
director of
wow.
the survivor team of UNICEF, so I can reach out to her easily.
Anytime,
Yes,
yes.
this would haven't been possible without
This
seeing.
program, yeah.
Yeah.
So, I mean, I think that's really interesting because the thing that we're seeing more and more for women who have participated in CEO of the Day is what you've described: confidence, visibility, influence. I mean, uh, we had someone saying that 3 years later she was out somewhere and someone was calling her CEO, you know? So it's given a lot of visibility. How did you feel on that? I mean, I think you've kind of described it. I mean, obviously you had a lot of opportunity that day, but if you think about you came into the office that day and you were leaving that evening, the next day, did you feel different? What changed for you?
Yes, I felt different because I was working in a community health facility.
Okay,
So I was leading as a medical doctor in that facility. So I was both managing care and managing community health
okay,
and all what is about administration and all that. And in the health leadership, I was at the very operational position. So I felt like even people at my N plus, even I had an easy access without asking for anything and every that could be difficult to my N
otherwise,
plus
yes.
one and my N plus two. So when I was coming to the office that day was okay. So I
I
can
can ask for anything I want.
ask whenever I
Yes.
want to change something. And she was very the director of the child survivor of UNICEF was very empathic,
Hmm.
and she was very open-minded and wanted to do all her possible to support me
Wow.
in my position. And even when the UNICEF consultants were coming there, they would tell you, oh, even when if we are coming in this place, we have to visit you and to
Yes.
tell her what are your challenges
Oh,
about
wow.
immunization or
Wow.
this or that. I would see on what we
We
could
can
do
do.
as
Yes.
with UNICEF. So it was a great support for me. And they were all like, even my staff was like, oh, doctor, since the moment you are there now, UNICEF is coming more and more here.
Yes. Yes.
And I felt supported. I
Wow.
felt very supported about those issues. So I'm talking mostly about immunization because it's one of the core
Focus
work,
areas.
yes,
Yeah.
of UNICEF. And in my department, it was what they were one of the core things they are supporting. So immunization and community health
Hmm.
workers.
And there's 60 of you who have been through the program now. I mean, I know that you guys are slowly building a little alumni group. What is that like? I mean, have you been able to stay in touch with some of the people who have also participated?
Yeah, so I would really like to recognize the leadership of Anik,
Hmm.
that was the CEO of the day of M10, that is really doing an incredible work in order to build a community around all the CEOs. So I've been supported more than my work in UNICEF.
Okay.
So even when I wanted to make the breast cancer activity for Pink October in October, so I wanted to do a campaign in a lake city where women were not screened for breast cancer. So most of the activities were in town, and I wanted to go to a remote area on a village where people never came for that. And it's true, in that community, no one ever came to speak about breast cancer to me.
Wow.
Yes. And I felt very supported by the CEO of the day. Even that day, there was also the CEO of the day of UBA that came
Came with you. Yes,
and
yes,
that went
yes.
into a canoe. You know, people are afraid of water,
Of
of
going on the water.
lake.
And she went in the canoe and
She went in the canoe, even the sea of the day of Ekjen, even in the preparation, they were very supportive. And I really felt that I had the community
around
around
here.
me. And I'm like, what is this going to give in 5 or 10 years?
I'm so curious about that. I mean, this year, as you know, we're trying to get to 100 companies to participate, and I think you're right. Like giving women a lot of confidence and visibility at a very early stage in their career will have major impact in the future. I think that's such a great story. I really like the story about Pink October. And in terms of your work, how do you think? Because you're a business owner. So you are actually a CEO, are you not?
Yeah.
Yes. You run a business. Tell us about that and how that has been for you. Like, has it shifted the way that you approach your business? Yeah, what's changed for you as a CEO?
First of all, because my business is addressed to women,
Mm.
so I know that I already
Yeah.
have,
You have a
yeah,
community.
I have a
Yeah, you
community.
have a community.
And as we have a mobile app, so tracking menstrual cycle, helping women at specific stages of their lives, even after menopause and everything, we want to make our app as a social responsibility tool for companies. And knowing that we have a point of contact in each of these companies is
How
a very,
interesting.
yeah, it's a very
I've
strong
never even
asset
thought about
for
that.
us. Yeah, yeah.
Access.
Even, yeah, access. Access. So we are launching with the new version of the app. And now for launching it, we want to give access, a free access to adolescents between 15 to 24 years
Okay.
old for free telemedicine. And now we are thinking about building this with companies. So this will be their social responsibility by giving access to those that don't pay
Mm.
directly, health workers to have
Hmm.
health advices and instant telemedicine. So I know that if I'm going to this or this company, I know
You have someone that
it's
you can
someone
call.
can call
Yeah.
and tell them, okay,
Yeah.
as a CEO of the day, this should
But this
be
is so great
your
because one of the most important things that you can do as a young woman, I didn't do it, I will share with you, is learning very early how to network and how to build your network. You know, I am a very naturally shy person. Yeah, yeah, yeah.
I don't believe.
I promise you, I am very shy. And so, you know, like, let's say I have to go into to an event, right? And I don't know anyone there. I just want to die. Like, I'm just like, oh my goodness, why am I here? You know? But you know what's happening with you guys now, the CEOs of the day, is that no matter what company you want to go into or talk to, like you have someone there that you know that you can at least that can at least be a friendly face,
Yeah.
right? And you can at least help have your conversation with.
Yeah.
This is fantastic.
And there is a public citation that says your network is your network.
Oh,
So,
amen.
of course, this is the network for every CEO of the day, even more than just about the 2025 CEO.
Mm,
I know that I can reach out to a 2020
2023, 24, yeah.
and ask them to help me reach even their own CEO,
Yes.
because by the moment you've been a CEO of the day, there is a particular link
You have
with,
to the
with
CEO. This is so true. Wow. See, you're even bringing ideas that I hadn't thought about, you know? I
yeah,
mean, so yeah, I think you're right. I mean, whoever has been the CEO of the day is definitely on the radar of the CEO of
yeah.
the company. And they have that visibility and that can help you in what you're trying to do. Wow. I love that. I love that. So this is a program that has been very helpful to you, obviously helpful for other women. What would you improve about it if you had to if there was something that you'd said, oh, if I wish I had this as part of the program when I was a part of it.
Yes, so I think what we would like to have maybe some sessions between CEOs
Mm-hmm.
and both with odd CEOs, but maybe with other managers, other CEOs,
Mm-hmm.
other than the real, not that they are fake CEOs, but also
You're
some
real
sessions.
CEOs.
But I know that if I have a figure that has run a business, the person can guide me and tell me where to go. So I think this is really a great network. And coming at that CEO of the Day event has permitted me to see those people that I was only seeing on LinkedIn and not in the real life. Yeah. Yeah, and I can tell you that even some people were looking for access to that CEO of the Day event because they knew that they would meet all the CEOs they were not able to meet.
Yes.
So yeah, that's it. And I know there is TITA, digital
Mm,
skills. Maybe it could give some points
I
to
see. Okay.
CEOs, yeah, to have access to that because it's true that technical skills are important, but networking, soft skills are now
Also,
the
the
core
most
aspects
important,
there that people want
yeah,
to have.
yeah,
You need some asset that technical skills are not
that
going
doesn't
to give.
necessarily give
Yeah,
you,
and
yeah.
school is not going to give
Mm,
you everything.
mm.
And maybe we have the network now, but we are not yet realizing what this network is going to
In
be
10,
5,
15
10
years.
years.
Ah,
So you have the future leaders
absolutely.
in this network. So you have to make sure that you have a connection so that, in this 5 or 10 years, maybe someone is going to be the minister, so maybe someone is going to
No,
be
but
the
that's
best
very true.
MTNC or so you
Yes,
can just pick your
yes,
phone and
yes,
call
yes,
directly and solve
yes,
your
yes.
problems.
You gave a speech at our women's program a couple of years ago. I I think, I mean, obviously, very important speech, but what struck me the most was, you know, I remember at your age, the idea of public speaking, I would have just cried. Impossible. Where did you get this confidence from? You weren't even supposed to be speaking on, and you ended up speaking, and you did it beautifully. Where, how?
So I think I have to thank my dad
Okay.
because he noticed that I was a very shy child and I was all the time with him. So I was 8 when I was finishing primary school, and he looked at me. He told me that even if he loved me the most, that I won't be with him
Forever.
forever, and that I had to know. And then he sent me to Ghana, and my mother wasn't able to call me, and he was, yes, you have to do that. You have to leave her by herself. That helped me to really improve some skills, or even at that moment wasn't improving but developing. I was very shy. People was mocking at me because they say I had great or big eyes and I will be crying. And there is Mrs. Tosu that has I don't know if you remember her, she also took the prize of Le Benin event.
Mm-hmm.
So I forgot her given name, but she is in the transport travel agency sector.
Okay.
She brought me to her room because she was the one that organized that trip to Ghana and told me that if someone tells you that your eyes are big, tell the person that the most beautiful persons have big eyes. And that 8 years old girl, so
This
I
was
can't
so important.
imagine.
Yes, of
Yes, because
course.
I built my confidence on
Around that.
so sometimes I'm very strict about myself, but I've also learned about forgiving myself and telling myself that I've done the best. And I think if I didn't have that exposure that my father did, it was at that moment, I'm sure that with my mom, my mom was not okay with him, but
Mm-hmm.
today I'm thinking,
She agree. I'm sure she's,
yes,
yeah, of
yes,
course.
but no, I'm sure that my father is like, oh, I have a daughter now that is far away from me.
But also, he must be incredibly proud of what you've done.
Yes, but my dad is an African dad.
So there's always more you should be
Yeah,
doing.
yeah, yeah. Even if their father, I'm not the one that will be coming out and telling you, I'm proud of what you are doing. I heard it once or twice, and I was really surprised. I also heard it from my uncle, not directly from him. Yes, he's a true African dad. And even till today, even when I travel to my event and I'm telling him that I'm traveling, we do the only thing that my dad is going to tell me, okay, do your best to be excellent. And I'm like, it's because I told you you are telling me to be excellent, as if I didn't know that
I have
I
to
have
be
to be
excellent.
excellent where you are going. So it's not like I'm proud of you and everything. It's like, okay, be
But you'll
excellent.
be surprised, I think, I mean, my parents as well, I think it's a it's a different generation, right? And sometimes find it difficult to express these words, but he's so proud. I bet you that behind closed doors, he's talking about all the work you're doing, which is why your uncle is telling you the same thing. So they're having discussions, which means that he's proud, It's wonderful to hear that. It really is. And did your family know when you were CEO of the day? Were they aware?
No,
You
because
didn't tell them?
the other side is that so when we've been living in, even so the second part was that when I graduated from secondary school and I had to start university,
Hmm.
my father told me that at university you have to start by yourself. But he left me and he was like, I'm not going in to put you in a can bring you to university. No, you are the one going to know by yourself. The
Everything you need to
university,
do,
everything.
yes,
So, by that moment, I've learned to do things
by
by
yourself.
myself. So, it's true there is that difference between me and my other colleagues that are that who have shown what they were doing to their parents. I know that is something I
So
have
you've been
to.
independent at a very young age.
Yes, yes. I'm
Mm.
sure that if you hear a lot of those African dads, is that they will be telling you, my dad has a particular sentence, and when he starts that sentence, oh,
What what is the sentence?
I left my parents by the age
It
of
just-
7. My studies were the only thing that helped me do
Yes,
something in
yeah.
life. So I'm like, okay, blah, 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 blah. So I don't think it's the best thing to do because every child is different.
Sure.
And it wasn't the same process
For your
for
siblings,
others.
yeah.
Yes. And maybe because I'm the firstborn, I know African parents.
First, I'm a firstborn as well, so I get it.
You
Yeah,
see, so when I
yeah.
see something like what is allowing this, I'm
They're tired now.
like,
It's a different time, No, that's great. So let me ask you a question. Now that you've been through the CEO program, obviously, Dr. Vivian, there is so much you have achieved. Um, what advice do you have for young women who are coming up, like yourself? I mean, you're young. It's not as if you're not young. So let me not even say that. But, what would if you were talking to another young woman about the CEO program, what would be your advice? Why should they participate in the program?
they should because they would have a support.
Mm-hmm.
And that is very important. So I do not trust the concept of self-made man or self-made woman. That doesn't
Exists,
exist.
yeah.
It's a big, big, and big
Lie.
lie.
You're gonna have a lot of people texting you after this episode.
They they should forget about that self-made concept.
Because everyone needs and has support along the way, no matter who you are, right? This is the point you're making.
This
Yeah.
is the point. Even if you are the son of the president, in a way or another, at a
There's
point
been
you
some
need
support,
support.
sure.
So support is a very great thing. And in our environment where you know what you learn in school doesn't always match with the need of the employment environment, you need
Mm,
to have someone that will be showing you the way. What should you do? What are the extra skills that you
you
need to
need.
add? Someone to help you shape your pathway because no one help us if you do not go to them shape your pathway. And at a time we were chatting with
Mm-hmm,
my promotion
mm-hmm.
group with the MDs and someone told me, Vivian, everybody is not as lucky as you.
Mm,
I was like, no, 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 no,
I'm
no.
not lucky.
The dean of my faculty, I regularly come to his office for advice. And he is very happy when he sees one of his alumni coming back asking for advice. This is the only thing he's looking for. So even people, even those CEOs are looking for younger women to support, to go
Yeah,
at a
that's
step,
true.
but we are not going to them. My director of thesis, I regularly chat him, go for him, asking for advice for my pathway.
Mm,
Because my parents are not medical doctors. I do not have someone like innovating in Benin and that is the person
you
that
want to
I
go
want to
to,
look
sure.
like. So you need that support. That
You
support.
need infrastructure.
You need the infrastructure, yeah, of course.
Yeah.
And you need to meet Uche so
Uh-uh.
that she tells you that you need the
Infrastructure,
infrastructure
yeah.
because there is a particular link with Uche at the moment you are a CEO of the day. So that
Yeah,
is
no, but this is true because I mean, of course, if I meet someone in the future and they've been CEO of the day, it's an automatic discussion. Of course. Yeah.
so I think you need the network because most of the time we look greater than us,
Hmm.
but we do not look at our peers.
Who can also help?
Literally, yes.
Yeah.
And this is a point that we usually forget. So the supportive community is not just about people that are older than you or people that have greater experience than you, but it's also about having peers that will understand you and sometimes be
Hmm.
supportive. Or it can also be a way of challenging your
Sure.
ideas, what you are looking for, what you are building, etc. etc. So I think this is a very core reason to do the program CEO of the day
Hmm.
because there is not a particular school that
That
is
can
not.
teach you that. Yeah. I agree.
And I would really like to tell all those business leaders, why not even people from the government side or a public
Pourquoi
sector
pas?
side,
Pourquoi
yeah?
pas? I'm just saying.
Yeah. A minister,
Of the day.
we have a lot of
Yeah.
agencies,
Yeah.
so we can have a director of agency of
Yeah.
the day.
Yeah.
And I think this will be very helpful because when we are in our African countries, what we need is building a new kind of intelligence and a particular type of leadership that is specific to our real needs to go faster.
Mm.
And there is no a spontaneous generation. You have to prepare
You have to build it.
that
Yeah.
generation. And you see, so I think the CEO of the Day program has to be implemented in more and more, I will say, not companies, but
Sectors.
sectors,
Yes.
yeah, because we
Yeah.
really need more leadership. And women are culturally, in our context, more shy.
Uh-huh.
Even if they know more, they do not feel themselves, I will say, as confident to speak
Uh-huh.
about something
Uh,
that.
they know already. I suffered from that a lot when I was younger. I in meetings, and actually sometimes I still do it. I really don't like speaking in public. And so, when I was coming up in my career as a young person, I would be in meetings and I would just be on mute, the whole time. But I was very lucky that I had bosses who would be like, hey, hey, hey,
You have
what's your opinion? Say something now, you know? And so it really forced me to try and find my voice. But I agree with you. Like I still see a lot that, I mean, it's changing, but we still want to see more women speak up and share their opinions, and because they have great opinions and they're knowledgeable, as you said, and they should be able to express that. Yeah.
Yeah, because building things without more than a half of the population of
Mm,
a country
mm,
is delaying development. And women now should know that the government is building something or has built a political infrastructure that is, since we are talking about infrastructure,
yes.
yes, that is making things easier
Easier
for women, but they have to put
to
on this.
grab the opportunity. This is it.
This is
Yes.
a great opportunity in our country that is
Mm,
not
that's true.
raised, but you have to speak
You have
before
to
people
put yourself out there.
yeah, for
Yes.
people
Yeah.
to
To know
identify.
who you are.
Yeah,
Hmm.
but that doesn't come just
Naturally.
naturally. You
Yeah.
have at a point to start step by step, being a CEO of the day. So the CEO can tell you, okay, you have to correct this or that in your public speaking. Okay, you have to go maybe to the CEO of another company
Mm-hmm.
because maybe she is my friend or he is my friend,
Uh-huh.
and help you. So that's
Wow. Now that's really amazing. Dr. V, any parting words before we close?
so what to say. Mm, maybe to close, going to ask leaders to open the doors for the program CEO of the day. They might not understand right now what is going to bring back, but even for their own companies, it's going to increase productivity and results, and that is very important for development.
Wow. Dr. Vivian, I'm wondering where you're going to be in the next 10 years. Just no, I'm serious. Listening to you talk, I told you already, you sound like you've been on earth for many, many years. It's just a very, very wonderful conversation today. I always enjoy talking to you, and you're definitely one of the people that I have on my list of people to watch because I have no doubt you're just, you're so brilliant, and I'm so glad that we've had the opportunity to speak to you today.
And thank you. And you really inspire me.
Oh,
So it wasn't as what CEO of the day is building today is because a woman older than me have let me meet you.
mm. Yes,
So
you should tell this story actually.
yeah.
Yes, go ahead.
So I knew MTN because in 2022, right? So 4 years ago, because a lady called Dr. Modupe Age
Mm-hmm.
that has given herself a mission to be a bridge between the younger generation
Yes,
and the older generation has given me
I'm
the
not older.
no,
Continue.
that's but in the beginning like
Okay, so bridge between older and younger.
younger
Mm-hmm.
generation. So she just called me a morning and told me, okay, I'm not available at the moment to give a public speaking about women's rights and well-being issue, but I trust you and I know that you will be doing it great. And I will be giving you the number of the CEO of MTN. I was like, the CEO of MTN. I was looking at her on LinkedIn and I was already looking at, I was wondering how to connect with her. And like, now I just have her.
The number, look at that.
So just call her and tell her. And I really want to thank you, Uche, because you didn't know me.
Mm.
I was very young, but you
You're
trust.
still very young,
Yeah, I'm still very young.
but I trusted you.
Yes, you trusted me. And it wasn't like, okay, because she's young, she won't be able to handle it or not. And I felt very respected. And on that day, you gave an engagement. And that's where you got all my respect because I'm used to people older than me telling me, okay, we are going to help you or that and that. You told me when you saw the app that if something was possible to do, you will help to do that and bring the app to the other level. And we met at Novotel and you called directly your CTO. You told her to come because I have technical issues and you was laughing at me and you told her to help me handle that. And now she told me to reach out to Edosi.
Uh-huh.
Edosi that is currently our
I see.
CTO
Oh,
and
my
handle the
goodness.
app doing a great job.
Look at that.
So this came just by a single connection. And this connection, when you do not have a dad or a mom that is a public figure that could directly connect you, be a CEO of the day, and you
Yes.
are going to
To have all these
connections
connections.
to go to the other level.
Oh my God. Okay. So we're going to end on that note. That's a fantastic story, Dr. Viviane Oke. Thank you so much and all the best of luck.
Thank you.
Excellent. Thank you for listening to the Don't Let the Smile Fool You podcast. I hope you found it really, really interesting. But more importantly, I hope you're still smiling. See you soon.